Hvala lepa, Miha. Hitimo po našem urniku. Na vrsti je Rolf Angeltvedt, ki v Oslu vodi nevladno organizacijo Gay and Lesbian Health Norway. Ta del je v angleščini, če rabite samo pocukajte me za rokav, prevod. Gay and Lesbian Health Norway is a non-governmental organization specializing in LGBT minority health with a special focus on HIV prevention among men who have sex with men. Rolf Angeltvedt will address the importance of cooperation and sharing knowledge and skills in the struggle against HIV.
Thank you. Good morning. Dear friends, colleagues, and governmental representatives, thank you for the invitation again and the possibility for me to give you and my organization, the Gay and Lesbian Health Norway, comments at this symposium and give you some reflection about the importance of the Slovenian-Norwegian Partnership for Development of HIV Prevention in both our countries.
Sorry, you have to talk in the mic.
Oh, sorry. Then I have to move this one because I've written. Wait, sorry. Okay. Should I repeat that? No, I don't think so. First, I would love to endorse what Miha just presented for us and congratulate all the partners in this project. And I will take the opportunity to also to thank the Minister of Health participating in this seminar with pink and proper outfit. Maybe it was a coincidence. I don't think so. We noticed that. We can see that. So, and by being here, she also sent a signal to the field that she taking this seriously, and I'm impressed about that. That's very important. So I've already published it in Norway in our website that she was here. So I think the most important here is to continue and develop this special cooperation between the government, departments, health professionals, civil society here, and also in other cities around here, and with the possibility that the Norway grants and the EU grants makes us do. So, and Miha, it's also amazing all of the activities that you presented, and I also had the time to look at your websites. It's amazing how many activities that you have been done since I was here just 1 year ago. And we also have the pleasure to have a delegation from you in Norway, and because when we was here, you had so big ambitions in your proposal, in your projects. I was visiting you in the office and see all these huge posters of activities. So I was a little bit stressed when you should come to Norway. What should we do? So we arranged a lot of visits for you from the governmental point of view, the clinics similar to this clinic, the biggest clinics in Norway where you also visit, Olafia Clinic, and that you Sherry's, that we and you also participated in meetings with the national HIV organizations, with the national LGBT rights organizations in Norway, and we also made time for you to work with us outreach in the field to see what we are doing, how we are doing things, and I know that you also do the similar things that we'll see tomorrow. No, tonight, isn't it? Yeah. So I'm very glad to got this presented and that you made it. It's amazing. And I will also talk a little bit about the bilateral visits, how important they are. Because, as you told me, when we first spoke on the phone, I didn't know anything about Slovenia. I've seen you in the grants site. It's 15 countries. It's over 20 programs. It's a lot of NGOs taking contact with us from Romania, from Ukraine. Not in this matter, but we get a lot of contacts where organizations want us to just sign a paper to participate so that they can have some grants. And our policy is to, if we are going to cooperate with other organizations, we actually want to be part of it. So that we have to sign how many contracts? I think 20. No. It's a symbol that it should be a very important document for each partners, for every part of these projects. So, we are very proud to be a partner with you. And I would also point out that based on the visit that we had here last year, and looking into your results in your testing site, we actually now have plans to implement new methods to try to find more gonorrhea and chlamydia in our testing site. I think we this year will test 2,000 MSM in Norway in our project, and we don't test them for gonorrhea and chlamydia. So we will try to find new methods to give out home sampling kits so that they can take the test in all openings by themselves and send it into the laboratory. So if the prevalence is as high in Norway as you have, we will be the most impressive testing site for that also. So that's very exciting. So that's one good example that we are inspired from you, from the data and activities you actually do very well in cooperation with the laboratory here in Ljubljana. So I can also understand the frustration about the finance mechanism that you have told me a lot about. And also that Norwegian partners and other partners that I meet in Norway from a governmental point of view also is very administrative challenge. So, and I have to say that it's a challenge for this program that so much time are spent on administration instead of hands-on prevention work and making it work and look into quality and doing things better. And this is of course a high burden for the civil society and poor small organizations that doesn't have the manpower to reach the demand from the grants program mechanism or operators. And I'm talking especially about the NGOs with no funding. They have only project money to do the project. So I think it's very important to stress that, to see how we can make it easier for everybody. And it's very impressive to see how all the partners in these projects collaborating and manage, or at least manage to try to cooperate together. I know it's not always easy to find the right setting to cooperate together. There are some stress and there are some discussions about how to do things. Of course there should be. Resistance is a very good thing in all projects, I think. But I would love to stress that it's very important to keep up this cooperation, that you I'm not hearing you talking so much about it. You're talking about results, the effect and everything, but actually the results of the cooperation between you in different levels is a very a very good results. And I know the Minister of the EU, we have our own EU minister in Norway to deal with these issues, and they stress this very much. They are there's a very high focus on bilateral cooperation, but also cooperation in the country. So you can highlight that a lot more, I think. That's very important. So, the time is running, I think. So infection figures increases, and I will say that we are testing too little. We need further investment in innovative test offers targeting key population affected in the HIV epidemic, such as MSM. We are experiencing an increasing number of sexual transmitted infections, as gonorrhea and chlamydia, among the same target group in our country. Public Health in Norway reports that 300% increase in HIV cases, 500% increase in gonorrhea, and 400% increase in syphilis among MSM since 2002. So we have seen a curve going like that. The epicenter of infection is like in Ljubljana in Oslo. So you have probably the same situation here. Gay and lesbian health want to step up tests performed by test pilots project for home testing. That's something we want to try this autumn. And today there are actually no good data on how many among MSM groups test annually. A combination of representative data and registered data suggests that an estimate indicating that only between 15 and 25% of MSM are testing annually. And that's a very low number. With this background and the results we saw presented here today, this kind of services actually are working, but only if we can link these men to medical care to decide. Test and treat are proving working. We cannot afford not to use it in every single case we disclose. So I have a challenge for you. Let men who have sex with men who test positive anywhere in Slovenia have an opportunity to use medical service here in Ljubljana, where the expertise is. Discreet and anonymous testing for MSM is probably the most important we can offer this group. And the treatment has also met some discreet and anonymous facilities because of the strong stigma HIV presents. Maybe also in the future, free home testing for STIs and HIV can be an important method to have more men tested for these infections. Finding MSM who can have use for PrEP or PEP will also be an issue in the future that these activities can solve. Okay, I think I will stop there because we will talk about the future later. But I would say that when my minister launched this program 2 weeks ago, she said something about cooperation, and she focused on an inclusive Europe, and I will quote her. We need to make sure that the future belongs to all of us, that everyone has an equal opportunity to lead prosperous life. We will continue to work to ensure that Roma children can go to normal schools and get a good education. LGBT people are respected for who they are, and that refugees and migrants are met with respect in accordance with the law and our international obligation. This is our common moral obligation as a partner and citizens of Europe. Thank you.